Good evening, everyone. And tonight I'd like to explore the topic of fibroids. What are fibroids and what do they do in a woman's uterus? Well, fibroids are developed from cells within the uterus that are smooth muscle cells that decide to start um, reproducing themselves and they get large. The unique thing about fibroids is that instead of invading through the muscle, they actually sort of grow and expand out. As they expand, they compress the cells around the periphery, which creates what we call a pseudocapsule, fake wall, if you will, such that if you were to take the fibroid out, you can actually um, peel it off the capsule. It looks like the membrane when you have a hard boiled egg and you crack that and that membrane you peel off. The capsule can look like that. The difference in fibroids, it's where they're located. If they're located right inside the uterus, they're called a submucosal fibroid. And I'll also show you some pictures of that. If they're located in the meat of the uterus itself, they're called intramural fibroids. And if they're located right under the surface of the uterus, between the surface and the endometrial layer, they're called the subserosal fibroids. Now, tonight I want to focus a little bit on the ones that are located right dab squab in the middle of the uterus. Those are the ones that call submucosal fibroids. I had a patient recently who asked me, oh, gee, I've had this fibroid. It's located in my uterus and I've been advised to remove it and I don't feel like it. And, what could possibly happen? Well, she had in actuality a fibroid that was sitting right inside the cavity of her uterus, almost like the size of her fibroid was almost the size of an egg, which is quite large for what is called a submucosal fibroid. Now, if you will, bear with me, let's go back a little bit of history lesson here. I don't know if many of you realize that those sorts of fibroids can actually act like an IUD. Think about it. Back in the days, the Bedouins, when they crossed the Sahara Desert, they crossed the desert in Africa, they had to use this big camels to traverse the desert. And during this journey, it was not favorable to have the camels get pregnant. So what did they do? They stuffed the uterus of the camels with stones, right? So that irritated the womb. It prevented implantation, it prevented proper lodging of an embryo, and they didn't get pregnant. Well, if you are walking around with a fibroid that size inside the uterus, you're essentially walking around with your own personal IUD, if you will. So such fibroids actually probably need to be removed so that it will give room for an embryo to properly implant. So I hope that it addresses the question of a submucosal fibroid. How do you know you have a submucosal fibroid? Usually it's detected on ultrasound, but most commonly it induces heavy bleeding during the menstrual period. Some people may get extra pain or cramping, but mostly a submucosal fibroid will cause a lot of pain. So if you're walking around with one of those, please have it evaluated and possibly removed. That's like walking around with your own personal IUD.